I'm Anne McLeod, and I'm here today with Amber Kolibaba, both of us with the Trent Center for Aging and Society. You've probably seen our webinar for a little bit of a deeper dive on social isolation and volunteering in rural areas. But today, we're going to have just more of an informal conversation. The team and I worked with included Dawn Barry-Merriam and Sterling Stutz, along with our other researchers and Age Friendly Peterborough. At the start of the pandemic, we recorded experiences of older adults, their family caregivers, their paid and their unpaid caregivers. The pandemic disrupted their normal relationships and services required to maintain their mental, physical, and social health. Supportive relationships really suffered, increasing mental strain, worries, and they also had declines in physical health. We also examined documents that guided the public and organizations during the pandemic. Amber and her team members, Dr. Mark Skinner and Dr. Elizabeth Russell, have provided some great insight from long-term older adults volunteers who on average have been volunteering in Selwyn Township on average for 18 years. The resiliency of these volunteers and adaptability of programs supporting older adults enables services to support seniors living in rural areas. The research team has some questions for Amber. As we pass the 2-year mark of the pandemic, we're sharing some of the same challenges and ways that individuals, families, volunteers, organizations, and communities have adapted between our two projects. Older adults and those that support them had a spotlight shine on them regarding the inadequacies of our system of caring. We know that everybody, but particularly those in the front lines of service provision, are not able to sustain what they gave during the pandemic without supports. In order that older adults can thrive in their homes and communities, we need to initiate dialogue with users of service, paid and unpaid volunteers, and the decision makers. Amber, your study highlighted how on a personal level, training around virtual services can benefit older adult volunteers and users. Our participants made the suggestion to decision makers to provide technological support as well. Was there any platform or technological tool that the volunteers would have liked training with, or any other challenges they faced with technology as a result of what you found out?
It's a really great question. Thank you, Anne. For the most part, volunteers really adapted to the technology that they were urged to use during the pandemic. So for example, in the Selwyn Fire Department, online training was switched from in-person training to online, where they needed to learn how to use particular platforms like Zoom or WebEx to complete mandatory training requirements. So while it was challenging for some, they saw the need for technology in these kind of advanced ways. And if they wanted to continue volunteering, a lot of volunteers saw that technology was needed to be able to continue that. The issue in rural areas, though, is that there are limitations around internet connectivity that cause challenges for many participants when wanting to use some online platforms. And this is something that we're seeing in this project, but just in rural areas in general, and some of the limitations that come with broadband and high-speed internet in more rural and remote areas. So for some of our participants that started using Zoom, for example, for monthly committee meetings, their role was limited in what they were able to do on the meeting because of their internet, and maybe they had to call in. But as we know, face-to-face is so important. So having that kind of interaction, if you're unable to have that sort of interaction due to limited internet and you're just having to call in on the Zoom line, it's not really the same as if you're, first of all, in person, and secondly, kind of on Zoom. So we found that was a big challenge for a lot of individuals. A question for you, Anne. Caregivers, paid and unpaid, needed information and access about infection control and protective equipment. Did your participants suggest how to get that information for themselves?
Well, it's interesting you talk about Zoom and the internet, because what they wanted was really that clear two-way communication, and with their whole circle of care, with the adult at the center. So including their family members, their unpaid caregivers, as well as their volunteers and maybe other service providers. And they all really wanted to be on the same page. So I'm wondering, some of them had volunteers coming into their home during the pandemic. Did any of the volunteer organizations that you worked with describe that in their adaptive responses?
Yeah, so collaborative communication and just communication generally was a really big in terms of the adaptability from the volunteer-based programs. And when it came to some of the changes caused by the pandemic, the programs really needed that open line of communication between themselves, volunteers, but also just patrons and the people that they did serve as well. So some of that in terms of, updating change in policies, and we're now doing this online versus in person. Sometimes it was, unfortunately, we can't bring you back right now because of the safety of the volunteers. Sometimes it was also that open line of communication in which they really started from the program perspective, was that they just checked in on their volunteers. Sometimes it wasn't even for letting them know about policy changes. Sometimes it was just, how are you doing? And, how's everything going? And, just having that, even if it just is a 5-minute phone conversation, it was described as being really great from a program perspective to check in on their volunteers. And as you said at the beginning, sometimes they've been volunteering for 18 years. So you've developed that rapport and that relationship with each other. So really just checking in to see how each other were doing was really instrumental in continuing that relationship between program and individual. For you, Anne, collaborative communication among volunteers and service providers and the older adults is really great practice, and that will ensure sustainability of our long-term volunteers and also our care providers. At a community level, how do you think we can entice volunteers and health and social service providers to carry on when reducing the strain they feel?
Well, it's interesting that you were talking about just checking in and the "Hi, how are you doing?" phone calls, because what we heard, both our volunteers and our paid health and social service providers, was that they felt under-respected and undervalued. And when we see that disconnect between what we value, when we saw the outrage of what happened with our older adults during the first wave, yet the funds that we sanction our government to spend on restructuring home and community supports for older adults just hasn't matched that outrage that we have. There's so many benefits gained by volunteering and caring for older adults, but the older adults and paid and unpaid caregivers just don't believe that their care that they provide should have that negative impact on their health and social and mental well-being. So we really want to make sure those most vulnerable aren't pushed aside as we rebuild our region as one that's a great place to age in place. The participants in our two studies made suggestions, and we'd really like to hear from you all. So if you're going to respond to this video, just generally state where you're calling from, which community, whether you're an older adult or your relationship with older adults. And I encourage you to carry on the conversation about how we can address sustaining and supporting our older adults, volunteers, and programs that support them and the communities in which we live. I look forward to the discussion.
Thank you.